This video covers the protocol and requirements for paramedics regarding the access of existing PICC lines. Please note that this is not an independent authorization. All procedures must comply with Pennsylvania EMS scope, agency credentialing, and medical director approval. It is crucial to understand why this training is necessary. A PICC line is a central venous access device, not a standard peripheral IV. Pennsylvania regulations permit access to these lines only under specific scope, training, and medical command. Safety depends on your ability to verify if the line is appropriate for use. This course focuses on assessing and accessing an existing PICC line. It is not an insertion course, nor does it cover home health care or central line blood draws. Remember, this curriculum does not override your state scope, regional protocols, or local medical command. Our learning objectives are to correctly identify PICC lines, understand your clinical scope in Pennsylvania, determine when a line is appropriate for use, demonstrate aseptic technique, and recognize potential complications during patient care. Regarding Pennsylvania scope, paramedics are permitted to access existing central venous catheters that feature external ports, such as PICC lines. However, initial central venous cannulation is not permitted, and blood sampling from these lines is not a standard paramedic function. Always verify your specific agency policy. This reference chart illustrates the differences between various vascular access devices. Note the unique characteristics of the PICC line, which requires distinct handling compared to peripheral IVs or other central devices. When in doubt, prioritize patient safety and contact medical command. To maintain clear boundaries, remember what is permitted. You may assess and access an existing port once authorized. Use the line for allowed medications and monitor the patient. You may not insert or reposition a line, force a flush, or draw blood from these central lines. Medical director credentialing is the final step for authorized use. It should encompass formal education, observation, and periodic competency reviews. If your agency's policy regarding PICC access is unclear or missing, do not improvise. Contact medical command for direction. When deciding whether to use an existing line, follow this decision ladder. Confirm that your action is within scope, authorized by your service, and medically necessary. Finally, always perform a visual inspection to ensure the line is secure and undamaged before proceeding. Your agency-level policy should clearly define who is authorized to perform these access tasks, the specific indications for emergency or interfacility use, approved flushing methods, and the necessary documentation for quality assurance reviews. Before you touch the line, verify the clinical necessity, confirm the line type, ensure it is free from site problems, and confirm that you have the appropriate equipment for aseptic access. Use this checkpoint as a final safety buffer. This decision tree is a vital tool for field providers. It guides you through the process of determining if vascular access is truly needed, if an alternative is available, and if the PICC line meets all the criteria for safe and authorized use. To summarize, a PICC line is a peripherally inserted central catheter. It enters through a peripheral vein in the arm, but terminates in central circulation near the heart. It may have multiple lumens and requires careful handling as a form of central access. Understanding the anatomy of a PICC line is essential for safe access. Familiarize yourself with the insertion site, the transparent dressing, the securement device, and the external lumens used for medication administration. Always keep these components clean and intact. In this video, we have covered the identification and authorized use of PICC lines. Always keep your local agency policies and protocols nearby, and remember that patient safety is the ultimate priority when managing any form of central venous access. Patients may have PICC lines for several reasons, including long-term antibiotic treatment, chemotherapy, or the need for total parenteral nutrition. They are also common in patients requiring repeated medication or those undergoing interfacility transport with ongoing infusions. You may encounter PICCs with single, double, or triple lumens. Treat every hub as a potential site for contamination. Do not assume a lumen is patent or intended for EMS use, and never remove caps unless specifically directed by local policy. It is essential to distinguish a PICC from a standard peripheral IV. While an IV is short and peripheral, a PICC is a long catheter with a central tip. Because of these differences, PICC use must always be a deliberate, authorized decision, rather than an automatic one. Midline catheters can look similar to PICCs from the outside, but they do not terminate centrally. Never guess based solely on the insertion location. If you cannot confirm the type of line, do not treat or use it as a PICC. Other devices, such as implanted ports or tunneled catheters, require specialized handling. Implanted ports are under the skin, and tunneled catheters carry unique risks. Unless you are familiar with these devices and follow specific protocols, do not attempt to access them. Visual assessment is your first line of defense. Always take the time to inspect the entire device, from the insertion site to the hub, to understand what you are working with before attempting any interaction. A crucial warning: dialysis catheters are not PICC lines. They carry a high risk of infection and complications. Do not use dialysis access in the field unless you have specific, approved medical direction. Protect the device and use peripheral or intraosseous routes instead. During identification, look at the whole patient, not just the tubing. Trace the catheter, check for paperwork or labels, and confirm the usage history. Always verbalize your findings aloud to ensure clear communication during your assessment. When deciding whether to use a line, remember that convenience is not a medical indication. Always evaluate your clinical needs against the risks. If you are ever unsure about the line's safety or type, the safest action is to leave it alone. Use this decision tree to guide your actions. Following a standardized process ensures that you only use existing PICC lines when it is truly necessary and safe to do so, based on your current field environment and authorization. Appropriate EMS indications for PICC use include situations where urgent medication or fluids are required and peripheral access is delayed. Ensure the line is clearly identified, clean, and authorized for use by your specific agency and medical command. Know the red flags that indicate a line should not be used. These include an unclear line type, a compromised dressing, or signs of local infection like swelling or redness. Never attempt to use a line that appears damaged or blocked. Assess before you access. If the patient reports pain during use, or if you feel resistance when flushing, stop immediately. Your goal is patient safety, and recognizing these red flags is critical to preventing further harm. If a line lacks proper labeling, documentation, or identification from the patient or family, do not guess. If the catheter route looks abnormal or you are managing multiple devices, avoid the risk and use an alternative access route. Finally, remember that you should not attempt to fix a compromised dressing in the field. If you notice blood, moisture, or signs of inflammation, avoid the line entirely. Document your findings and report them to the receiving facility staff. When you encounter a PICC line, pay close attention to potential red flags. Look for cracked catheters, leaking hubs, or missing caps. If the line appears shorter or longer than it should be, or if you feel resistance when flushing, do not attempt to force it. Protect the line and use alternative access. Engage with your patient or their family to gather essential history. Ask about the type of line, its primary use, and when it was last accessed or flushed. It is also important to ask if anyone has reported concerns like potential infection, clogging, or if an infusion is currently running. Deciding between a peripheral IV, an IO, or a PICC line requires clinical judgment. While an IV is preferred for reliability, an IO may be best in emergencies like cardiac arrest. A PICC line is only reasonable if confirmed, intact, and authorized. Don't waste critical time troubleshooting a questionable line. Contact medical command if you are unsure about the line type or medication compatibility. You should also call if there is an active high-risk infusion or if you suspect line damage. Remember, medical command is a resource to support your assessment, not a substitute for it. Use this final decision checkpoint. Use the PICC only if there is a clinical need, it is clearly identified, the site appears safe, and you are fully credentialed and authorized. Ensure you can maintain a sterile and aseptic process before proceeding with access. We are now moving into the critical steps for safe PICC access. This decision flow highlights the core of your procedure, emphasizing that your assessment must be completed before you take any action. Infection risk is the most significant concern with central lines. A PICC line provides a direct route to the central circulation. Never let the urgency of a call lead to poor technique. Always set up your workspace and maintain a clean environment to ensure patient safety. Hand hygiene is mandatory before you touch the line or any associated supplies. Always wear clean gloves and change them if they become contaminated. Use a no-touch technique and be sure not to touch any part of the connector that has been cleaned. Scrub the hub thoroughly, using an agency-approved antiseptic. Apply firm friction for the required contact time and allow it to dry completely on its own. Do not blow on it, fan it, or wipe it dry. If it gets contaminated after cleaning, repeat the process. This visual demonstrates the proper hub disinfection technique. Proper hand position and control are essential to avoid recontaminating the site before you make your connection. Always maintain a clean technique throughout the entire process. Maintaining a closed system is vital. Never leave an open central line unattended. Properly clamp the line according to your agency's policy and use only clean caps and tubing. Be careful not to lay connectors on contaminated surfaces and secure the tubing to prevent accidental pulling. Field environments present unique hazards like motion and cramped spaces. Stage your supplies before you begin and coordinate with your partner to manage the patient and equipment. If the environment is too chaotic to maintain a safe, clean process, choose an alternative route. Ensure you have all necessary supplies before you start. This includes clean gloves, antiseptic swabs, flushes, medications, IV tubing, a pump if required, and securement devices. Being prepared prevents unnecessary delays and reduces the risk of error. Preparation is the key to safety. Always confirm your medication and fluids before opening the hub, and prepare all your equipment first. Position the patient so the line is protected and easily monitored. Never start an access procedure without having all your supplies at hand. To wrap up, follow this standard sequence. Confirm the need, inspect the device, prepare your workspace, disinfect the hub, and ensure patency without force. By following these steps, you maintain the highest standards of safety for every patient.